This is a short video of some of the ethical considerations Group 1 thought about. One ethical issue we considered was privacy. As portable EEG scanners become more available, opportunities for misuse arise. In the paper Privacy for Personal Neuroinformatic, they say EEG data appears to be highly unique to an individual and thus should be considered extremely sensitive. Although EEG scanners do not pose much of a threat as they stand, it is important for engineers to keep possible misuse in mind when developing such technologies. Here is what some portable EEG scanners look like.
Another ethical issue that arises when developing a code to diagnose a patient with a medical condition is a medical malpractice. Looking at our code, it could correctly identify only 90% of the conditions, so there's a very high chance of correct identification, but it does not guarantee 100% correct diagnosis. As users of this code would be medical staff, they wouldn't know the algorithm of the code, so they wouldn't know if the code worked correct for this specific case that they're trying to diagnose. This would raise mistrust to the diagnosis both from medical staff and the patients, and I think it would be ethically wrong to diagnose someone using this code.
Another ethical issue is informed consent, which means the patient is clear on the pros and cons of the AI being used. The patient is given a brief explanation on how the code works and the risks and past experiences with the AI are clarified. Then the patient is given a choice to use the AI or not based on the knowledge they've learned.